Good morning and welcome to our health and wellness segment with me, Shiko Kaitani. Karibu sana as well through our social media platforms to continue engaging us. It's always a pleasure coming to you, giving you great content, and we also appreciate the feedback that we continue to receive at K24 TV across the board is how you can reach us, Instagram, Facebook, X. We've got our WhatsApp number at the bottom of your screen should you wish to contribute to our ongoing discussions on K24. I'm surprised today my director is not the one and only Bonadan. We've got Kasavuli on the decks. She's the one who's going to be controlling today's show. Nimesikia akisema nimefika masaa yangu Kasavuli ushaanza kunibuli, but we love you, honey. Karibu sana on the controls, and of course let me know if we can start off with our Vox Pops, because we did collect a few in regards to today's show. So cue me on that as well as on our feedback. And speaking about our topic, we've got a good one for you. We are tackling chronic diseases this morning. Africa is confronting a daunting new healthcare challenge when it continues to struggle against many of its long-time nemesis. The healthcare system on the continent has always been strained, if you think about it, under pressure from deadly infectious diseases. And now, unfortunately, there is a sharp rise in non-communicable diseases. So today, we will be understanding what those diseases are and those catastrophic effects and just why we need to pay attention. We've got the pleasure of having the chairperson of the Chronic Disease Society of Africa. I'm talking about Faith Okwisa Okwayo. Faith, welcome to the show.
Hi.
Looking lovely.
Thank you so much.
All right, so even as we hope our viewers will start texting in, I think just, to give this conversation some context by understanding what your missions, your goals, your mandate, if you will, as the Chronic Disease Society of Africa is all about.
Yeah, thank you so much for the segment. At Chronic Disease Society of Africa, we are very keen to alleviate the burden of the chronic illnesses in Africa, and starting from Kenya, because this is where our nascent chapter is.
Okay.
So chronic diseases are a double whammy, because in Kenya right now, we are having an intersection between chronic illnesses and communicable diseases. Right. So we have not totally eliminated the infectious diseases, and yet we have a spike of chronic illnesses. So we have responded to the WHO call for action on just being here to make sure that the primary healthcare coverage of chronic illnesses is being underscored by the governments. And the government is already overwhelmed as it is, so we're here as a third party to fully and just make sure that we are here to take care of the patients who are living with chronic illnesses.
And so when we talk about what these chronic diseases are, I know there's a whole range of them, but maybe you can give us the top killers that honestly are really causing this burden, and you're seeing more and more of it on ground. So what would you classify?
So in Africa, about 41 million cases of mortality are coming from the top 4 categories, which are cardiovascular diseases, diabetes, cancer, and lung illnesses.
Oh, wow.
So these ones are very prevalent, and we have a spectrum of over 26 chronic illnesses. But the top 4 are cardiovascular diseases, which encompass the heart diseases, diabetes, which is highly proliferated across Africa, and obesity even.
Wow, can you imagine Africa getting to the point where we're dealing with issues of obesity?
Yes, because of behavioral changes in our food production. We are obesity is here with us, and obesity is not the orthodox definition that people think someone has to look big for them to be obese. You just have to have a BMI of above 30. So you could really be normal looking, but you are carrying extra weight. And overweight is a metabolic syndrome that now leads to so many of these chronic illnesses.
Okay.
Yes.
Well, we took to the streets as our breakfast crew, and of course went to speak to Kenyans about their view and their take on chronic diseases. Take a listen.
What chronic diseases do you believe are common amongst Kenyans?
One of the most chronic diseases is such as cancer in Kenya, among others, but I think cancer is the one that's mostly affecting Kenyans.
Mostly cancer, arthritis, are the most commonly known chronic diseases.
I think there's cancer, diabetes, I think high blood pressure.
Hizo makansa.
Throat cancer, pancreatic cancer, yes, and also tuberculosis can also be counted one of the chronic diseases.
Some of the chronic diseases I know, it's like cancer.
We have cancer, we have the arthritis, we have the tuberculosis, we have the HIV and AIDS. Yeah, and even malaria nowadays is also chronic. If you don't go to the hospital, we have the I don't know, it's called acute malaria, which where you have that severe headache that may, if you don't visit the hospital very quickly, you can even die.
In your opinion, are all chronic diseases attributed to lifestyle?
I don't think so. Yet it's still a factor, but it's not the most, you're seeing the cause of it. No, it also depends with how someone takes care of himself health-wise. So it all starts with you and how you do your stuff, what you eat, just hygiene.
Poor lifestyles, yes, because poor lifestyle, because of what we eat, we don't exercise, and we also don't go to the hospital. You're supposed to go for checkup at least annually or even daily. We don't go.
Napata kwa hali kwingine wenye unakaa ma area zingine ni kuchafu hivi, saa vitu kaa hizo.
Some of these diseases are actually brought by the kind of foods that we eat. Like nowadays, so many people take a lot of sugar, these plastic things, and even the environment that where we live. People they don't live in the kind of the environment that we live also lead to these diseases.
Most of them are brought about by lifestyle. For example, some of the cancers, for example, throat cancer, lung cancer. As you know that most of the people, they engage in drug abuse, especially cigarettes, smoking cigarettes, and they cause cancer. So they are brought about by lifestyle. Kuna also high blood pressure, or it's also known as hypertension. It's brought by.
Okay, so you can hear a few of the comments, or at least people's thoughts on chronic diseases. And Faith, what's the general feeling that you picked up on from what Kenyans were saying on the streets? Does it mean that, okay, are we still at the point where there's a lot of lack of awareness?
Yes.
Or at least people have an idea.
People have an idea, and they are very right.
Yeah.
However, there's still a lot of work to be done in terms of creating awareness, education to reduce the level of stigma in the society, where now the patients are being stigmatized for having chronic diseases because they are attributed to lifestyle. They're not necessarily just lifestyle, because you'll find even in the low and middle income communities where people are just eating the most basic of foods and maybe even just using the vegetable oils alone, they can still trigger chronic illnesses.
Right.
So it's not lifestyle in the sense that we think we know.
Okay.
Yeah.
And it's interesting because when I was actually reading up on this, they talk about how modernization rather is a huge factor or key factor that has increased the risk of developing these diseases. But how so? People moving to urban areas, think about, what life is like in the city. So talk to us a little bit about that.
So urbanization is a big risk factor towards exacerbation of chronic illnesses, mostly diabetes. I will talk about the metabolic syndrome.
Yeah.
Because now change of lifestyle, because initially we were meant to be hunter-gatherers. We had the Paleolithic diet where we were eating boiled foods, eating one meal a day. Then once you are urbanized, you have to now adjust and have more of processed foods, which sometimes then the crystallization cause a lot of glycation in the body, leading to chronic illnesses. So by the time now you're going for your checkup, and mostly everybody has a risk of being pre-diabetic, because just by virtue of aging, you are predisposed to diabetes. So if you're not going for your regular checkups, and then you find that by the time you're hitting your late ages, like you're becoming geriatric, you are realizing you have diabetes and you've been having it for 10 years.
All right.
So the late diagnosis is what now leads to now high cost of disease management.
And it's very sad because when you think about how these diseases creep up on you, it's unfortunate because, like the way you're saying, some of these are conditions that people are living with and have no clue that they are on the onset of it.
Yes, yes.
And then you get up into your mid-ages, into your senior years, and then now it's full-blown.
Yes.
So this is why we need to pay attention to this, because you never know. These are what they call the silent killers, right?
Yeah.
But I want to put this up for our viewers, Faith, and listen to what the World Health Organization actually described chronic diseases are. Now, NCDs, and Faith obviously will expound more on that, non-communicable diseases, that's what it stands for, are the result of a combination of genetic, psychological, or physiological rather, environmental and behavioral factors. Tobacco use, physical inactivity, the harmful use of alcohol, and unhealthy diets are all increase the risk of dying from a non-communicable disease. So let's just stop there, Faith, for a second. Because look at that, genetics, physiological, environmental, behavioral factors. So it's almost like there's no winning with chronic disease.
There's no winning, and they say 85% of mortality comes from a chronic illness. And the virtue of the fact that it's chronic, it means you have to be maintained on medication till mortality.
Right.
So once you're diagnosed with it, it's not a death sentence per se, because you can then now have this best practices that will reduce the symptoms. But now you have to live with it for the rest of your life, maintain the medication. So the reason why we formed the Chronic Disease Society of Africa was triggered by this, by the fact that prevention can be better than cure in this sense. Delay of the onset of the symptoms is better. And then now just educating the patients and engaging the communities to understand how to sometimes navigate when they're already diagnosed or prevent. So we have a lot of early detection camps and patient screenings that now lead to patient education.
Yeah, and let's just pick up on that and just talk about the importance, you know, when we are talking about screening, when we're talking about how important prevention is. Why does this matter, and why should we be pumping in more money, more resources into that, prevention and screening?
Simply to reduce the cost of treatment. Because already in Africa, we are facing, like we said, a double burden. And in Africa, we are also underinsured. Insurance is not prevalent, and we are still working on getting the primary healthcare coverage. So as we are dealing with all these problems, including poverty, we do not want also to add the cost of living and the disturbance of economic factors, which, you know, once you're diagnosed with a disease, you're not able to be very productive economically. So early detection helps prevent this, and it helps educate people early on, because most of these diseases are multimorbid. What do I mean by that? Once you are diagnosed with diabetes, you are highly likely to die from cancer. Yes, it's not diabetes that kills, because diabetes now just makes your immunity very, very weak. And then now, because of all that medication, you can lead to other predisposition of metabolic syndrome, that's heart disease, then cancer, even chronic kidney disease. So early detection can now help reduce the comorbidities of these diseases.
Well, remember, you can actually weigh in and also text us through our WhatsApp number at the bottom of your screen. If you prefer, obviously, using other social media platforms, well, karibu sana. Kasavoli, please do let me know when we can actually start looking at text messages as we move along. But for now, let's talk about the challenges that individuals are facing in managing and treating those chronic diseases. What are these challenges?
The first challenge is lack of awareness, because most of the people, after they've been diagnosed with chronic illness, they are discharged and then they become very stranded. Because the doctors are already swamped, they have a lot of queues, and they do not have sometimes time to take the patients through the patient journey. So now patient journey education is lacking, patient engagement is lacking, and community building is lacking. Then there's now the pharmaceutical end. Africa, we are not enjoying a lot of equity when it comes to pharmaceutical drugs, because most of the chronic illness drugs, chronic segment drugs are imported. So by the time they have landed, the margins are spiked, and then the cost of the drug is high. And sometimes we are mostly 40% out of stock for these drugs.
Right.
So a patient is still trying to access the medication that they need. They're still trying to afford. Affordability is an issue.
Right.
And then they don't even know how to handle themselves at home. Some of them, their caregivers are maybe in Nairobi and their parents are maintain drugs in the rural areas.
Right.
So lack of engagement of these patients and communicating on how to navigate the patient journey is an issue. And we step in that gap as Chronic Disease Society. Once the patients subscribe to become our members, we put them in small cohorts. Very small ones where they are having access to the community-based healthcare workers who are now navigating with them, and advising them daily on how to treat the symptoms, when to see a doctor. We link them to care. We make sure that they can access the specialists and navigate. Yes.
That's amazing. And of course, you'll tell us how that structure actually works, because at the end of the day, you know, we want our viewers to understand, okay, if I have a loved one or me myself have been diagnosed with disease X, what next? How do I actually join these little pods that obviously will help me get the kind of health care that I need? So that's a very important thing to just put a pin on. As we're getting towards the tail end, we'll be asking Faith to tell us a little bit more about how the structure works, obviously with the organization, which is the Chronic Disease Society of Africa, and those pods that are available for you to actually join. Now, the impact of this perhaps isn't really felt on a large scale. But I like to break things down to the family unit, because they say the family unit is the SI unit of society. And when you think about what happens when a family member is sick with a chronic disease, how does this negatively impact the family?
First, it causes a lot of confusion, and then there's that shock value, especially let me speak about cancer. And I have a very personal story where I lost my dad to cancer during Corona. So, you know, when Corona hit, there was a disruption in the Medicare and
so
healthcare ecosystem, right? It's fine. So chronic diseases are not visible. So it's so hard for the society to even try and treat them urgently, as urgent as they need. So unless maybe when you have a disability, it's visible, someone can say, hey, this needs action. But for chronic illnesses, because it's a slow burn, it's hard to see. So my father, back to the story of my father, he was diagnosed with diabetes. And he was being treated for diabetes, well treated for diabetes. Because of lack of that patient education of knowing how to navigate diabetes, the diet aspect of it, what to do, what not to do, what to avoid. He lived his lifestyle but taking medication for diabetes. Little did he know it will accelerate to kidney disease, to cancer, to heart failure, you know. So once you have diabetes, you should not go back and relax and even say, hey, I don't even need medication anymore because I'm feeling okay. No. Once you have that disease, you have to take it very seriously, so that it doesn't generate into a more adverse effect. Yes.
It's interesting, now that you brought up COVID-19, and like you're saying, the pandemic changed everything. It's sad because even if it caused this disruption, there was also it accelerating these diseases. And so talk to us about how COVID actually affected the management, the treatment of these chronic diseases.
Yes, so we had a privilege of doing a study in 5 African countries, sponsored by the Global Fund, on post-COVID disruption of access to medication for people who are in diabetic clinics, tuberculosis clinics, HIV, and even cancer. So once COVID set in, of course, there was that nervousness in the ecosystem, and most patients were asked to stay at home, because once you have COVID and you already have a low immunity, your chances of survival were slim. So that gloom made patients stay back and not go to access their medication. So most patients succumb to their chronic illnesses because they could not access their primary essential drugs.
Right, and then remember how challenging it was even to get to a health facility. You're being told wait.
And then the doctors were receiving the patients with a lot of prejudice, of course, rightfully so. And then there was that holding period of 24 hours to observe. So that really affected patients because of just the stress level of it. And remember, depression is a chronic illness. Mental disorders are very chronic.
And please say that again. Yes, it is now a chronic.
It's a chronic illness. Alcoholism is a chronic illness. And all these are interrelated. There's a lot of intersection and overlapping of these conditions. So having personalized patient education, where patients, there is a community that spends very good time with these patients to educate them on what to avoid and what to do, is very essential. And we stepped in that gap. There are so many unmet needs, but information is the first step towards disease management. Disease surveillance and planning is needed. So the chronic illnesses are taken for granted, largely by the governments, because they are busy just trying to ease the burden of the other infectious diseases or other diseases that are visible. But the 50% killer right now in Africa actually is chronic illnesses.
That is very worrying news when you think about it. Faith, allow us to take a short commercial break. When we actually get back, there's definitely more to come as we discuss what the solutions are. What's the comprehensive approach, FYI, that we're going to be using towards chronic diseases going forward? And I think, you know, just listening to what this particular organization is doing, it's great. Let's also listen to some of the partnerships, collaborations that are out there helping individuals who are living with this particular chronic diseases, okay? But yet again, as we take that commercial break, you still have that opportunity to engage with us. Give us your thoughts. Our WhatsApp number 075-7725-083. We will see you in just a few. Welcome back to the show. This is Health and Wellness with me, Shiko Kaitani. We're having a great time with the lovely Faith Okwisa. She's the chairperson from the Chronic Disease Society of Africa. Also looking dapper this morning. I'm loving the look. I keep telling her, by the way, I can't get over her dress, by the way. Faith, welcome back.
Thank you so much.
So as we talk about the burden of chronic disease, remember we're also a solution-based program, meaning that we want to tell you what the Chronic Disease Society of Africa are doing for individuals with chronic disease. It's very important to understand where is all the support and the access to healthcare coming from. So we'll jump into that and also understand some of the collaborative efforts that are out there that you can also plug into. It's also important. These non-communicable diseases, as Faith put it, are actually what are silent killers today. The cancers, the diabetes, the obesity, okay, and the numbers that we're dealing with. It's pretty worrying to understand. So when you hear the term NCDs, you know this is really, really important because you can't see it, okay? The cancer is there, the diabetes is there, you can't see it. So what next? Okay, taking a look at your feedback. Hala Masanti Sana for tuning into the show. You're going to say that, hello Shiko, chronic diseases are surely preventable. People just don't realize that garbage in, garbage out. It is poor lifestyle choices and our disregard for our planet making us sick. Wow, what do you think about Harlem?
Wow, that is a bold statement.
Right.
However, there's, of course, a margin of error because not all chronic illnesses are necessarily because of garbage in, garbage out. Some of them, like we said, even the WHO has stated that they are genetic, physiological, and environmental factors. So it's not all about food. However, there's also food addiction in the society. That, you know, is a dopamine issue, and that's why we need to educate the patients on how to reduce the food addiction, how to manage, so that they can be able, because sometimes food addiction is even caused by the substances in the food that we cook.
And they do it intentionally to make you keep coming back.
So that you're addicted to it.
Right, the chemicals that are being used in the food, cause the addiction.
Yes, I love that. Yes. So even the vegetable oil we keep using.
Yes.
Okay, there's so much misinformation and mistruths in the society. The vegetable oil we keep using to fry our mandazis, to make our chapatis, that is what causes chronic illness, not even the alcohol. However, alcoholism is a whole other topic because it's also a chronic illness.
I like what you said because she was cracking me up during the break. She's like, do people think when you just drink and smoke, that's what gets you to get your chronic disease? No, even the mandazi can kill you.
Yes. Even mandazi, even rice,
even
anything
rice,
white on your plate can easily lead to chronic illness. And that is just, it's a very complex mix of what you eat and every other factor.
I can't wait till we have that discussion in an upcoming day. Today is just an overview. It's just an overview. But we're going to go deep with Faith very soon, okay? And actually start challenging you about what's on your plate. Okay, Annie Southby, good morning, darling. You go on to say, always watching K24. Woo! Thank you. You go on to say, thanks for the teaser. Perhaps ask your panelists how each and every one of us can play a role in reducing the burden of chronic disease today. What can we all do?
The first thing is, first of all, to empathize with those who are already sick and support them to access the help they need in terms of linking them to care, having a proper referral pathway. And next is just drink your water, have your brisk walks, do the bare minimum. What you can do for yourself so that you can support others is to take care of yourself. So drink your water.
I'm following
Say
instructions.
this. There's nothing like too much water. The more the water, the better, because of the churning of the toxins. Yes, drink your water and stay active.
Then stay active. Kasavuli, I'm drinking my water. Are you? Okay. Lucky Degwa from Nakuru, good morning. You're going to say, more effort has been placed towards fighting your infectious diseases such as HIV and TB. The messaging is everywhere about protecting yourself. Where are the campaigns about cancer, diabetes, and high blood pressure? They should start putting these up in social joints to remind us what's coming up should we fail to take action. I actually like that. Loki is like, yes, put posters up in all the Nyamachoma joints. Can you please put a poster up and be like, what are you doing? Okay, why are you here every weekend?
Yes.
Ukikula nyama choma. Are you aware what's waiting for you?
Yes.
I like that.
Yeah, I like
yeah,
that too.
scare people into action. But this actually brings us to our next point. And to be honest, messaging is key. The campaigns are key. So what are we doing in terms of the awareness, Faith? Like, what more needs to be done so that when we talk about how fast the communication is around infectious diseases like HIV, you remember how it was back in the 90s, in the 80s. There is nowhere you would turn and there wasn't something about HIV awareness. What can we do so that we are slapping people in the face with diabetes campaigns, cancer campaigns? Yeah.
So as Chronic Disease Society of Africa, we have so many initiatives. And to mention a few, we are partnering with institutions that are already in the healthcare industry. Remember, we have about maybe 13 to 15,000 doctors in Kenya against the population of almost 60 million. So they're already overwhelmed. So the first action is to support the healthcare system and not to vilify it, to support it so that it can have that fluency of engagement.
All right.
So we are, as Chronic Disease Society of Africa, we are partnering with every level 4, level 5, and level 6 hospital to establish patient education centers.
Yeah.
So that now post diagnosis, the patients can have somewhere to go and cry. You see, like when you go for VCT, you have that 1 hour of counseling and then that information and awareness and reduction of that stigma. So already there's also stigma in diabetes, the stigma in cancer, the stigma in chronic kidney disease, the stigma in arthritis, and you are always constantly in pain, and there's that level of inflammation. So you might not know how to handle yourself. So you need that level of support, first of all. So we have established a lot of patient support programs in partnership with our counties to start there. The next is partnering with, of course, education system, the KMTC and the universities that are training healthcare practitioners so that they are empowered and enabled by the time they are graduates to know how to even do early screenings and early detection.
Right. Fantastic. This brings us to the point of now understanding about a little bit of the structures that you have put in place. You had called them, okay, fine, I called them pods. Yes. But I like the idea of you grouping people based on their region, right?
Yes.
And so for me who's watching this show, maybe my mom is, dealing with diabetes and I'm in Kwale, or there's somebody who's watching right now and they're in Lodwar. So when we talk about these little pods that are around, how do they work? How do they function? How does someone also just say, okay, I want to be part of that, but I don't know where to go?
Yes. So we are creating visibility.
Okay.
And of course, also it's very personal and private to be sick. Not everybody wants to share. So we have created ethically maintained groups within every sub-county.
Okay.
To be able to call members, and also there are different disease categories with different needs. So we are doing a lot of disease penetration. So in these small groups, they are led by our doctors, our clinicians, our community-based health workers, and they are guiding patients on what to do on the next steps and how to do what we call self-management at home post-diagnosis, where to access the cheap medication. We even negotiate for better lab, because most people don't get detected because they do not go to proper labs, or they go to labs that are ill-equipped, and the labs also need that empowerment so that they can do proper screening when patients go there.
Correct.
So just referring these patients to the right labs, referring these patients to the right pharmacies where they can get proper, good medication, because there's also a lot of influx of, I dare say, counterfeit medication. Yeah, we need to reduce this. So advising our patients on best practices is what we do by putting them in the small groups of up to 20 people within every sub-county based on disease category. This will also help us understand disease population, to inform policy on how to manage better in wherever regions.
And this is why you were talking about why the data matters. So research also needs to be equally funded, together with the preventative programs that you have on ground and the, and the management programs. Because if we don't have the data, we don't know what we're looking at. Is that the situation?
Perfectly said, because R&D, research and development, is the only thing that leads to new like let me say new disease treatments and all that. So in Africa, the reason why we suffer so much is because we don't have any data that is reliable. We don't have any data that is ethically obtained. So we've created this institution that has ethical observance and is already underscored within the data collection observance programs, so that we can use this data to enable the government to plan better for these diseases.
Correct.
So we are collecting this data to improve research, to improve pharmaceutical equity by our patients being able to be exposed to clinical trials, because you know the genomics differ. In Africa, we get medication from other markets that have not been tested on ourselves. So we don't know. Cancers are very variant, and it's so hard to even understand cancer as per the black body. That's why the mortality rate of cancer in Africa is so high. It's almost 99%. Because studies have not been done within ourselves, because we get even diagnosed at stage 4 when we are already dying. So who is there speaking for us and taking care, making sure that we are taken care of?
Absolutely. This is so vital. And you guys really do have your work cut out for you. And I mean, when I just think about it, honestly, it is such a gigantic mission, you know, that you have, being able to actually collect all this information. But even as we start to wind up and of course get your final remarks, let's still listen to what Kenyans had to say in regards to chronic diseases.
In lifestyle, if you you don't do exercises, and also your diet, the way you eat,
Is there a certain age group for the chronic diseases to attack?
I don't suppose so. You'll likely get that disease because of how you just carry yourself. So be it you're a teenager or an adult, you're open to get these chronic diseases. It's just for you to be careful.
Before we could hear that most of these diseases were only attacking the aging population. You know, where the aging population 65 and above, the youthful population. But nowadays, I think most of these diseases even they can even get this youthful age, even the children, because there was a time also even my own brother, he had got pressure, but when we went to the hospital, he was asked, "But you are still young." So from that day, I also have a cousin who is also having arthritis. The cousin is around 22 to 23 years. So I think nowadays the disease can get up with everybody. There's no age bracket.
I think it's general. Nowadays, anybody can get cancer, high blood pressure, diabetes. I think this is now a problem that affects almost everyone, from babies to old people.
Mostly because according to my observations, when one is young, actually many times you don't feel, you feel healthy, you feel very apt. But as one grows, then you find that there are many other diseases coming up. Mainly mainly cancer.
It doesn't mean so, but as the statistics are, larger percent of those people who get the lung cancer or the throat cancer is gotten by those people who use cigarettes, and also by those also growing cells on the kind of chemical, because some of these soft drinks that we consume, they are also made of chemicals. So it can also cause the throat cancer and the lung cancer. But kids, according to my own thinking, I don't think they can obtain more lung cancer because they don't involve themselves with cigarettes or drugs.
Thank you so much for your feedback.
All right, thanks so much to the team who went out on ground just speaking to Kenyans about chronic diseases and how much we understand as the public about them. Faith, just picking up on a few things there and, on what some of the individuals said. I mean, they're not obviously specialists, but people have an idea about, where we're headed and what the situation or the causes of these issues are. But I want you to stress our next point to the younger audience watching, that we should also care. It doesn't matter if you're a 23-year-old watching this show. Why should you care about chronic diseases? And why should you be bothered? Because like someone said there, we always used to think this is something, you know, when you're up in age that you can concern yourself about when you're older. Why should I care now?
Because chronic illness is not what you think it is. It is very, there's a myriad explanation or myriad categories of chronic illnesses. Most people think it's just heart failure or just diabetes. No, there's so many. We have depression as a chronic illness, substance abuse as a chronic illness, and this is affecting young people, and even Facebook addiction. I'm not saying the Facebook addiction is a chronic illness, but addiction in itself is chronic. And young people, okay, there's a lot of penetration, digital penetration, and young people have grown up in the digital age, and they might not know when their dopamine is being elevated by just a certain addiction, and that addiction alone can make you now have chronic illnesses earlier than you should. So yeah, there's so many reasons they should care, and also we are all somehow gonna die from a chronic illness.
Whoa, so guys, si wazee pekee wanaenda. Okay, did you listen to that? People as, you know, in their 20s with arthritis, people dying of cancer at the age of 28, 30. It's really sad to even just see how we're losing so many people. But anyway, time is up, Faith. I want you to actually give us your planner. So what are your organization's key priorities? What are going to be your goals going forward?
So our key mandate is to prevent these chronic illnesses and to support those ones already diagnosed with it to manage it better. So we are narrowing down on visibility and surveillance of the disease. So early detection is our core mandate, increasing vaccination for the diseases that can be prevented, and now increasing access and affordability of medication for diseases that have already been diagnosed, and just supporting the healthcare ecosystem and supporting the government where we can, and also asking for government engagement and support in our processes.
All right.
Yeah.
All right, let's wish you all the best on that. Last but not least, for those who actually want to engage further, look up more on the organization, especially when it comes to those, you know, those pods we're talking about. How can people actually reach the Chronic Disease Society of Africa?
So we have our website, www.cdaafrica.org. There you can be directed to our local offices and our local point of contact people. Yes.
Fantastic. Thanks so much, Faith, for making time this morning. We appreciate your company. She is the chairperson from the Chronic Disease Society of Africa as we discuss the burden of chronic disease. Remember, we are just scratching the tip, okay, of that iceberg. We're going to be unpacking more in the coming weeks with Faith and individuals who are experts in this space, because like we said, we each have a responsibility. We may not be the experts, but we can provide the experts to actually spread the gospel, okay? And so with that, we hope that this particular segment was informative. If so, why don't you let us know through our social media platforms. Again, if you always need a contact and you feel that, by the way, I missed that, go straight to my DM as Shiko Kaitani, which is SHIKOKAITTANY. Send me that DM. I'll be sure to actually link you up. Let's leave it there as we have the dynamic duo, obviously, of Tony and Sarah coming up next for the next 1 hour as they get interactive. See you tomorrow. Bye-bye. Thank you, Dan.